5 billion people worldwide lack access to safe surgery. More people die as a result of that than from HIV, TB, and malaria combined. Canadian anesthesiologists are working to change that through an organization named CASIEF.
The role of CASIEF is really important and remarkable. CASIEF didn't come to work, they came to build us. That is really important.
CASIEF's mission is to improve access to safe surgery by creating local partnerships to develop anesthesia training programs where they are needed most.
Partnership is key because it puts people as stakeholders. They all share the responsibility. They all share the planning.
In Rwanda, the 1994 genocide had a devastating effect on the number of doctors in the country.
After genocide, we had one anesthesiologist. That was Jean.
Dr. Jean d'Arc Uwambazima was the only local anesthesiologist left in all of Rwanda. The lack of anesthesiologists prevented access to safe surgery, intensive care, and treatment of maternal complications and trauma. She knew that her country needed help.
If we could recruit more and more residents to anesthesia program, that would increase more and more anesthesiologists in the country. That would reduce the burden we are facing.
Dr. Jean reached out to CASIEF. Could we help develop a desperately needed anesthesiology training program?
We were dreaming to have young Rwandan physicians joining the program, and then after the training, be involved in teaching.
Starting in 2006, we worked together to create a curriculum. CASIEF volunteers then traveled to Rwanda monthly to provide hands-on training. CASIEF also helped bring Rwandan doctors to hospitals in Canada to advance their expertise.
There is kind of programs where northern people will come and just do the program without integrating the local population, without integrating you part of the planning. Then at the end, you don't know what is happening. You just see people coming and moving. So what I benefited from that program was sharing of information.
Today, past graduates are conducting clinical research, informing national decision-making for surgical care, and teaching the next generation of Rwanda's doctors.
CASIEF, they come, they train, and they make you someone. Like, look at me. I'm the product of CASIEF somehow. They created the capacity to do what I'm doing today. And they should be proud of that.
CASIEF helped transform access to safe surgery in Rwanda and make it a leader in anesthesia. For over 50 years, our volunteers have helped create life-saving anesthesia training programs around the world in countries including Nepal, Guyana, and Burkina Faso. CASIEF has worked with local doctors to transform care. But our biggest challenge has just begun. Ethiopia is one of the fastest growing countries in Africa. Over the past 30 years, the population has doubled to more than 110 million.
There's only 50 anesthesiologists in the entire country, both in the rural and private and public hospitals.
In Ethiopia, 14,000 women die every year in childbirth. The vast majority of these would be preventable with improved anesthetic and obstetric care.
We have still limited access to subspecialty cares. There is a gap between the care we give and the demand of the patient.
In the capital city, Addis Ababa, CASIEF has helped develop a new residency program for future anesthesiologists.
The first time I heard about CASIEF is when they came to our hospital. They were teaching us lots of things, from a simple intubation to discussion sessions, and they were helping us a lot.
Along with volunteers providing hands-on training, CASIEF has helped set up a simulation center so that trainees can practice skills before working with patients.
They don't limit themselves and they don't limit their knowledge, their service, their energy. So that's the biggest thing I've learned.
CASIEF has also joined a new training partnership in the eastern city of Harar at what will soon be Ethiopia's biggest hospital.
When I heard about that partnership, I was so happy because it helps us to get education in our country so we can learn here and we can also give what we learn to our people and to our country.
Together, we can build a new generation of specialist anesthesiologists, transforming access to safe surgery throughout Ethiopia for years to come.
Sometimes, being in third world country, you start losing hope. When you have some individual coming from CASIEF, then you start to get motivated. They've shown me that one person can actually make a change and can make a difference.
There is a saying, teach a person how to catch a fish. Don't give just a fish, we will eat it and we will need more. So teach us how to catch fish, we will catch it for the rest of our life.
Over the past decades, from Nepal to Rwanda and now Ethiopia, CASIEF has been working in partnership to develop leaders in anesthesiology. The goal is simple: saving lives. That's what we do.
Good morning. CASIEF was a great pioneer for getting a residency program in Rwanda, and we consider them as our mother in that.
For most of the members that came from CASIEF, we would really want to say thank you very much. Thank you from the bottom of our heart.
Thank you for making who I am now. And as you trained me, please, I encourage you not to stop. Continue.
The need is huge. We need more volunteers through CASIEF to come and join the effort started and help in the teaching to make anesthesia safer.
CASIEF. We have the solutions and the expertise, but there is still a lot of work to do. We can't provide our partners with the help that is needed without your support. Through your donations or by volunteering your time, together we can achieve our mission to save lives and reduce suffering. I'm Bruce Coburn. I support CASIEF's important work. They need your help to transform the lives of countless people. Please give generously.